Hi, friends and colleagues. I hope you're having a good time in Dubai. I'm very sorry I can't be with you in person. I'll show you why, and I hope you'll understand that I had no options. I have 15 minutes to talk to you about AI and the role of AI in helping us with staging endometriosis from surgical narratives. My name is Shaheen Kazali. I work in London, and my main area of interest is endometriosis. And the reason I'm not with you is that my house suddenly turned into this unplanned, but there wasn't anything we could do about it, and I couldn't possibly leave my wife at home with this situation. So, AI. You've all heard a lot about AI. I'm very sure that most of you are already using large language models in your day to day life and perhaps in your practice as well. And as you have noticed, large language models have progressed very rapidly with a really scary rate. And nowadays they can do things that was not imaginable even a year ago. This is an example, just the USMLE, which is the US medical exam for entry into residency, basically. And you can see that just between 2020 to 2024, the very rapid improvement in how well the large language models can perform on this particular test. Just to give you an idea, the pass rate is 66%, and nowadays most models can achieve up to 100%. So, but what's the use for us? As you know, the staging of endometriosis has always been something of a challenge. You're familiar with various endometriosis classification systems. This is an editorial that Professor Sari Dogan and I wrote in FVVO a couple of years ago about the idea that perhaps what we need is a unified language for endometriosis. And sometimes one staging system is not enough to cover all aspects of the disease, and perhaps we need more. But of course, that's difficult because it's time consuming and sometimes inaccurate. So you are all familiar with hashtag Enzian, and I hope Professor Keckstein has been able to make it to the auditorium as he had another commitment in another room. But hashtag Enzian, I don't need to go through it. You know it, you probably use it. VNESS, which is a system that I came up with, is less well known, perhaps barely known. And I will just explain to you very briefly what that is about. So the idea is to simplify the mapping of endometriosis. We have 9 compartments starting from left adnexa to the left pelvic side wall, left uterosacral ligament, and then we come all the way to the right. These are the 9 compartments. Each compartment can be 0, 1, 2, 3, 4, 0 being no endometriosis and 4 being deep endometriosis that is invading into its surrounding structures. And it looks like this. So when you look at these 9 numbers, if you look at the numbers at the bottom of the screen, you can see that this looks like a laparoscopic image, with the 1 on the left being the left adnexa and the 3 on the right being the right adnexa. 4 is your bladder and 1 is your rectum. So you can look at these 9 numbers and you can imagine how bad the disease was and where. Last year, we published the study that validated the scoring system, and we found that it actually has very good inter-rated reliability. Now, we were in Croatia. The creator of hashtag NZN with the creator of VNESS, and we went with Professor Keckstein with a lovely, memorable, very long cycle ride around the beautiful coast. And it gave us time to discuss and go through ideas. So we came up with the idea of this study. How can large language models help us unify the language of endometriosis? And how can they help us in describing the surgical findings in a standardized manner? So we formed a team which includes Florence Britton, Kain Fleischer, Oscar Barnick, my ex-fellows or current fellows, Arash Mohazzab, who helped us with the statistics, and Professor Saridogan and Professor Krento and Professor Keckstein. What did we do? So we came up with 50 surgical narratives, all made up, not real patients. These were done by Kyle, Oscar, and Flo. They sat down and they wrote 50 narratives. Then they staged it, each of them based on hashtag NZN and VNESS. Then myself and Professor Keckstein went through these stagings and confirmed the gold standard. So we now had a set of 50 narratives and the hashtag NZN and VNESS gold standard for each of them. We used 4 large language models. This was done in September last year. So we had GPT-5, we had Gemini 2.5, we had Claude, Sonnet, and we had DeepSeek. So we had 4 different large language models. And for each of them, we used 3 different prompts. And I will explain to you what I mean. So we asked them the same question 3 times, or we fed these models the surgical narratives separately and give them prompts in 3 different stages. And that gave us 15,000 values, which you will see here. So it basically generated this Excel sheet. You can see that there's 9 compartments for VNESS, 9 plus the F of NZN, which makes it 16. And you need to also remember, for comparison, VNESS has 5 points, as in 0, 1, 2, 3, 4, which is 5. And NZN for each compartment has 4 or 2, and that is 0, 1, 2, 3. And for F, we have either yes or no. We also have the left and right, which makes the comparison even more difficult. But we need to remember that the aim of this project was not to compare VNESS and hashtag NZN. I don't think that's necessary. It is to see for these two classification systems, how do large language models perform? What were the rules? So in the narratives, we didn't make any reference to hashtag NZN or VNESS, either staging or the names. Like we didn't say the B of hashtag NZN was 2. So we didn't cheat, basically. We did mention the sizes. We didn't mention things like large or small, so we were specific about the sizes. If some area was not affected, we didn't mention it. Sometimes we did, but it was a rule that we didn't have to go through each compartment one by one, because that would have been unnatural. And we didn't need to talk about what the procedure was and what did we actually do with the disease that we found. And we didn't use abbreviations or acronyms or symbolic shorthands. What were the prompts? So first, imagine we have the, say, ChatGPT, and we have our narrative number 1. First, we ask ChatGPT, hey, ChatGPT, here is a surgical narrative what's its VNESS and what's its hashtag NZN in this format. We didn't tell it what VNESS is or what hashtag NZN is. We relied on its prior knowledge of the two systems based on what's available in the public domain. The second time, and this is all from scratch, so the model does not remember from the first prompt. We reset, and prompt 2 now says, look, here is the surgical narrative, and here's what VNESS is about, and here's what hashtag NZN is about. But short, brief. Give us VNESS and hashtag NZN. And then the third time, we gave it not only the description of hashtag NZN and VNESS, we also gave it examples, and we fed the PDF of the publications for the two systems. What did we find? So, as you can see, VNESS, generally speaking, not surprisingly, was not really known to the large language models. Despite that, Gemini performed really well. So these are the percentage of exact matches, meaning that the model said exactly what the gold standard said. So in 85% of our narratives, 85% of the time, we had exact matches for VNESS when Gemini with prompt 3 was used, and this was 95% for hashtag NZN, which generally had better results with all large language models. So what did we find from these? So the results are very promising, meaning that it looks like that large language models can actually help us in defining hashtag NZN and VNESS if we just give it our surgical narratives. We need to keep in mind that even though this data collection was only done a few months ago, the models are already old. So we now have ChatGPT 5.2, Gemini is 3.5, I think, and so on. We only looked at perfect matches. So if we consider that, okay, we allow for one compartment mistakes, then it would have been a completely different story. So that's also something that we're working on and we're analyzing. The models will get better as we publish more data on these two staging systems. And the comparison of two systems, we need to keep in mind, is not accurate because, as I said earlier, the margin of error is more for VNESS because we have 5 points, 0, 1, 2, 3, 4. And for hashtag NZN, we have 4 points, 0, 1, 2, 3. And then we have the F of hashtag NZN, which can either be yes or no, and in most cases it's a no. But we believe that this is a good start, and it may be a start of us using large language models in our clinical practice more and more for endometriosis to come up with a unified language, and we can communicate with ourselves, between ourselves and with patients much better. Thank you very much for listening, and I look forward to seeing you all in person in the near future.